Acupuncture is a form of alternative medicine in which thin needles are inserted into the body. It is a key component of traditional Chinese medicine, TCM. TCM theory and practice are not based upon scientific knowledge, and acupuncture is a pseudoscience. There is a diverse range of acupuncture theories based on different philosophies, and techniques vary depending on the country. The method used in TCM is likely the most widespread in the United States. It is most often used for pain relief, though it is also used for a wide range of other conditions. Acupuncture is generally used only in combination with other forms of treatment. The conclusions of many trials and numerous systematic reviews of acupuncture are largely inconsistent, which suggests that it is not effective. An overview of Cochrane reviews found that acupuncture is not effective for a wide range of conditions. A systematic review of systematic reviews found little evidence of acupuncture's effectiveness in treating pain. The evidence suggests that short-term treatment with acupuncture does not produce long-term benefits. Some research results suggest acupuncture can alleviate pain, though the majority of research suggests that acupuncture's effects are mainly due to the placebo effect. A systematic review concluded that the analgesic effect of acupuncture seemed to lack clinical relevance and could not be clearly distinguished from bias. A meta-analysis found that acupuncture for chronic low back pain was cost-effective as an adjunct to standard care, while a systematic review found insufficient evidence for the cost-effectiveness of acupuncture in the treatment of chronic low back pain. Acupuncture is generally safe when done by an appropriately trained practitioner using clean needle technique and single-use needles. When properly delivered, it has a low rate of mostly minor adverse effects. Accidents and infections are associated with infractions of sterile technique or neglect of the practitioner. A review stated that the reports of infection transmission increased significantly in the prior decade. The most frequently reported adverse events were pneumothorax and infections. Since serious adverse events continue to be reported, it is recommended that acupuncturists be trained sufficiently to reduce the risk. Scientific investigation has not found any histological or physiological evidence for traditional Chinese concepts such as qi, meridians, and acupuncture points, and many modern practitioners no longer support the existence of life force energy, qi, flowing through meridians, which was a major part of early belief systems. Acupuncture is believed to have originated around 100 BC in China, around the time the Yellow Emperor's classic of internal medicine, Huangdi Niajing, was published, though some experts suggest it could have been practiced earlier. Over time, conflicting claims and belief systems emerged about the effect of lunar, celestial and earthly cycles, yin and yang energies, and a body's rhythm on the effectiveness of treatment. Acupuncture grew and diminished in popularity in China repeatedly, depending on the country's political leadership and the favor of rationalism or Western medicine. Acupuncture spread first to Korea in the 6th century AD, then to Japan through medical missionaries, and then to Europe, starting with France. In the 20th century, as it spread to the United States and Western countries, the spiritual elements of acupuncture that conflict with Western beliefs were abandoned in favor of tapping needles into nerves. Clinical practice. Acupuncture is a form of alternative medicine. It is used most commonly for pain relief, though it is also used to treat a wide range of conditions. The majority of people who seek out acupuncture do so for musculoskeletal problems, including low back pain, shoulder stiffness, and knee pain. Acupuncture is generally only used in combination with other forms of treatment. For example, American Society of Anesthesiologists states it may be considered in the treatment for nonspecific, non-inflammatory low back pain only in conjunction with conventional therapy. Acupuncture is the insertion of thin needles into the skin. According to the Mayo Foundation for Medical Education and Research, Mayo Clinic, a typical session entails lying still while approximately 5 to 20 needles are inserted, for the majority of cases, the needles will be left in place for 10 to 20 minutes. It can be associated with the application of heat, pressure, or laser light. Classically, acupuncture is individualized and based on philosophy and intuition, and not on scientific research. There is also a non-invasive therapy developed in early 20th century Japan using an elaborate set of needles for the treatment of children, Schnishin or Schnihari. Clinical practice varies depending on the country. A comparison of the average number of patients treated per hour found significant differences between China, 10, and the United States, 1.2. Chinese herbs are often used. There is a diverse range of acupuncture approaches, involving different philosophies. Although various different techniques of acupuncture practice have emerged, the method used in traditional Chinese medicine, TCM, seems to be the most widely adopted in the US. Traditional acupuncture involves needle insertion, moxibustion, and cupping therapy, and may be accompanied by other procedures such as feeling the pulse and other parts of the body and examining the tongue. Traditional acupuncture involves the belief that a life force, qi, circulates within the body in lines called meridians. The main methods practiced in the UK are TCM and Western medical acupuncture. The term Western medical acupuncture is used to indicate an adaptation of TCM-based acupuncture which focuses less on TCM. The Western medical acupuncture approach involves using acupuncture after a medical diagnosis. Limited research has compared the contrasting acupuncture systems used in various countries for determining different acupuncture points, and thus there is no defined standard for acupuncture points. In traditional acupuncture, the acupuncturist decides which points to treat by observing and questioning the patient to make a diagnosis according to the tradition used. In TCM, the four diagnostic methods are inspection, auscultation, and olfaction, inquiring, and palpation. Inspection focuses on the face and particularly on the tongue, including analysis of the tongue size, shape, tension, color, and coating, and the absence or presence of teeth marks around the edge. Auscultation and olfaction involve listening for particular sounds such as wheezing, and observing body odor. Inquiring involves focusing on the 7 inquiries: chills and fever, perspiration, appetite, thirst, and taste, defecation and urination, pain, sleep, and menses and leukorrhea. Palpation is focusing on feeling the body for tender ashi points and feeling the pulse. Needles. The most common mechanism of stimulation of acupuncture points employs penetration of the skin by thin metal needles, which are manipulated manually, or the needle may be further stimulated by electrical stimulation, Electro Acupuncture. Acupuncture needles are typically made of stainless steel, making them flexible and preventing them from rusting or breaking. Needles are usually disposed of after each use to prevent contamination. Reusable needles when used should be sterilized between applications. Needles vary in length between 13 to 130 mm, 0.51 to 5.12 in, with shorter needles used near the face and eyes, and longer needles in areas with thicker tissues. Needle diameters vary from 0.16 mm, 0.006 in, to 0.46 mm, 0.018 in, with thicker needles used on more robust patients. Thinner needles may be flexible and require tubes for insertion. The tip of the needle should not be made too sharp to prevent breakage, although blunt needles cause more pain. Apart from the usual filiform needle, other needle types include 3-edged needles and the 9 ancient needles. Japanese acupuncturists use extremely thin needles that are used superficially, sometimes without penetrating the skin, and surrounded by a guide tube, a 17th century invention adopted in China and the West. Korean acupuncture uses copper needles and has a greater focus on the hand. Needling technique. Insertion. The skin is sterilized and needles are inserted, frequently with a plastic guide tube. Needles may be manipulated in various ways, including spinning, flicking, or moving up and down relative to the skin. Since most pain is felt in the superficial layers of the skin, a quick insertion of the needle is recommended. Often the needles are stimulated by hand in order to cause a dull, localized, aching sensation that is called Dutchy, as well as needle grasp, a tugging feeling felt by the acupuncturist and generated by a mechanical interaction between the needle and skin. Acupuncture can be painful. The skill level of the acupuncturist may influence how painful the needle insertion is, and a sufficiently skilled practitioner may be able to insert the needles without causing any pain. Dutchy sensation. Dutchy, Chinese, pinyin, Dutchy, arrival of qi, refers to a sensation of numbness, distension, or electrical tingling at the needling site which might radiate along the corresponding meridian. If Dutchy cannot be generated, then inaccurate location of the A-cup ointment, improper depth of needle insertion, inadequate manual manipulation, or a very weak constitution of the patient can be considered, all of which are thought to decrease the likelihood of successful treatment. If the Dutchy sensation does not immediately occur upon needle insertion, various manual manipulation techniques can be applied to promote it, such as plucking, shaking, or trembling. Once Dutchy is achieved, further techniques might be utilized which aim to influence the Dutchy. For example, by certain manipulation the Dutchy sensation allegedly can be conducted from the needling site towards more distant sites of the body. Other techniques aim at tonifying, Chinese, pinyin, bi, or sedating, Chinese, pinyin, xiat, qi. The former techniques are used in deficiency patterns, the latter in excess patterns. Dutchy is more important in Chinese acupuncture, while Western and Japanese patients may not consider it a necessary part of the treatment. Related practices. Acupressure, a non-invasive form of bodywork, uses physical pressure applied to acupressure points by the hand or elbow, or with various devices. Acupuncture is often accompanied by moxibustion, the burning of cone-shaped preparations of moxa, made from dried mugwort, on or near the skin, often but not always near or on an acupuncture point. Traditionally, acupuncture was used to treat acute conditions while moxibustion was used for chronic diseases. Moxibustion could be direct, the cone was placed directly on the skin and allowed to burn the skin, producing a blister and eventually a scar, or indirect, either a cone of moxa was placed on a slice of garlic, ginger, or other vegetable, or a cylinder of moxa was held above the skin, close enough to either warm or burn it. Cupping therapy is an ancient Chinese form of alternative medicine in which a local suction is created on the skin. Practitioners believe this mobilizes blood flow in order to promote healing. TUENA is a TCM method of attempting to stimulate the flow of qi by various barehanded techniques that do not involve needles. Electro Acupuncture is a form of acupuncture in which acupuncture needles are attached to a device that generates continuous electric pulses. This has been described as essentially transdermal electrical nerve stimulation masquerading as acupuncture. Fire needle acupuncture, also known as fire needling, is a technique which involves quickly inserting a flame-heated needle into areas on the body. Sonopuncture is a stimulation of the body similar to acupuncture using sound instead of needles. This may be done using purpose-built transducers to direct a narrow ultrasound beam to a depth of 6-8 cm at acupuncture meridian points on the body. Alternatively, tuning forks or other sound-emitting devices are used. Acupuncture point injection is the injection of various substances, such as drugs, vitamins, or herbal extracts, into acupoints. Auricular therapy, commonly known as ear acupuncture, auricular acupuncture, or auriculoacupuncture, is considered to date back to ancient China. It involves inserting needles to stimulate points on the outer ear. The modern approach was developed in France during the early 1950s. There is no scientific evidence that it can cure disease, the evidence of effectiveness is negligible. Scalp acupuncture, developed in Japan, is based on reflexological considerations regarding the scalp. Hand acupuncture, developed in Korea, centers around assumed reflex zones of the hand. Medical acupuncture attempts to integrate reflexological concepts, the trigger point model, and anatomical insights, such as dermatome distribution, into acupuncture practice, and emphasizes a more formulaic approach to acupuncture point location. Cosmetic acupuncture is the use of acupuncture in an attempt to reduce wrinkles on the face. Venom Acupuncture is a treatment approach of injecting purified, diluted bee venom into acupoints. A 2006 review of veterinary acupuncture found that there is insufficient evidence to recommend or reject acupuncture for any condition in domestic animals. Rigorous evidence for complementary and alternative techniques is lacking in veterinary medicine, but evidence has been growing. Effectiveness. Acupuncture has been researched extensively. As of 2013, there were almost 1,500 randomized controlled trials on PubMed with acupuncture in the title. The results of reviews of acupuncture's effectiveness, however, have been inconclusive. Sham Acupuncture and research. It is difficult but not impossible to design rigorous research trials for acupuncture. Due to acupuncture's invasive nature, one of the major challenges in efficacy research is in the design of an appropriate placebo control group. For efficacy studies to determine whether acupuncture has specific effects, sham forms of acupuncture where the patient, practitioner, and analyst are blinded seem the most acceptable approach. Sham acupuncture uses non-penetrating needles or needling at non-acupuncture points, e.g. inserting needles on meridians not related to the specific condition being studied, or in places not associated with meridians. The underperformance of acupuncture in such trials may indicate that therapeutic effects are due entirely to nonspecific effects, or that the sham treatments are not inert, or that systematic protocols yield less than optimal treatment. A 2014 review in Nature Reviews Cancer found that contrary to the claimed mechanism of redirecting the flow of qi through meridians, researchers usually find that it generally does not matter where the needles are inserted, how often, that is, no dose-response effect is observed, or even if needles are actually inserted. In other words, sham or placebo acupuncture generally produces the same effects as real acupuncture and, in some cases, does better. A 2013 meta-analysis found little evidence that the effectiveness of acupuncture on pain, compared to sham, was modified by the location of the needles, the number of needles used, the experience or technique of the practitioner, or by the circumstances of the sessions. The same analysis also suggested that the number of needles and sessions is important, as greater numbers improved the outcomes of acupuncture compared to non-acupuncture controls. There has been little systematic investigation of which components of an acupuncture session may be important for any therapeutic effect, including needle placement and depth, type and intensity of stimulation, and number of needles used. The research seems to suggest that needles do not need to stimulate the traditionally specified acupuncture points or penetrate the skin to attain an anticipated effect, e.g. psychosocial factors. A response to sham acupuncture in osteoarthritis may be used in the elderly, but placebos have usually been regarded as deception and thus unethical. However, some physicians and ethicists have suggested circumstances for applicable uses for placebos, such as it might present a theoretical advantage of an inexpensive treatment without adverse reactions or interactions with drugs or other medications. As the evidence for most types of alternative medicine such as acupuncture is far from strong, the use of alternative medicine in regular healthcare can present an ethical question. Using the principles of evidence-based medicine to research acupuncture is controversial, and has produced different results. Some research suggests acupuncture can alleviate pain, but the majority of research suggests that acupuncture's effects are mainly due to placebo. Evidence suggests that any benefits of acupuncture are short-lasting. There is insufficient evidence to support use of acupuncture compared to mainstream medical treatments. Acupuncture is not better than mainstream treatment in the long term. Publication bias. Publication bias is cited as a concern in the reviews of randomized controlled trials, RCTs, of acupuncture. A 1998 review of studies on acupuncture found that trials originating in China, Japan, Hong Kong, and Taiwan were uniformly favorable to acupuncture, as were 10 out of 11 studies conducted in Russia. A 2011 assessment of the quality of RCTs on TCM, including acupuncture, concluded that the methodological quality of most such trials, including randomization, experimental control, and blinding, was generally poor, particularly for trials published in Chinese journals, though the quality of acupuncture trials was better than the trials testing TCM remedies. The study also found that trials published in non-Chinese journals tended to be of higher quality. Chinese authors use more Chinese studies, which have been demonstrated to be uniformly positive. A 2012 review of 88 systematic reviews of acupuncture published in Chinese journals found that less than half of these reviews reported testing for publication bias, and that the majority of these reviews were published in journals with impact factors of 0. Scientist and journalist Stephen Salzberg identifies acupuncture and Chinese medicine generally as a focus for fake medical journals such as the Journal of Acupuncture and Meridian Studies and Acupuncture in Medicine. Specific conditions. Pain. The conclusions of many trials and numerous systematic reviews of acupuncture are largely inconsistent with each other. A 2011 systematic review of systematic reviews found that for reducing pain, real acupuncture was no better than sham acupuncture, and concluded that numerous reviews have shown little convincing evidence that acupuncture is an effective treatment for reducing pain. The same review found that neck pain was one of only 4 types of pain for which a positive effect was suggested, but cautioned that the primary studies used carried a considerable risk of bias. A 2009 overview of Cochrane reviews found acupuncture is not effective for a wide range of conditions. A 2014 systematic review suggests that the nocebo effect of acupuncture is clinically relevant and that the rate of adverse events may be a gauge of the nocebo effect. According to the 2014 Miller's Anesthesia book, when compared with placebo, acupuncture treatment has proven efficacy for relieving pain. A 2012 meta-analysis conducted by the Acupuncture Trialists Collaboration found relatively modest efficiency of acupuncture, in comparison to sham, for the treatment of 4 different types of chronic pain: back and neck pain, knee osteoarthritis, chronic headache, and shoulder pain, and on that basis concluded that it is more than a placebo and a reasonable referral option. Commenting on this meta-analysis, both Edzard Ernst and David Calhoun said the results were of negligible clinical significance. Edzard Ernst later stated that "I fear that, once we manage to eliminate this bias, we might find that the effects of acupuncture exclusively are a placebo response." In 2017, the same research group updated their previous meta-analysis and again found acupuncture to be superior to sham acupuncture for nonspecific musculoskeletal pain, osteoarthritis, chronic headache, and shoulder pain. They also found that the effects of acupuncture decreased by about 15% after 1 year. A 2010 systematic review suggested that acupuncture is more than a placebo for commonly occurring chronic pain conditions, but the authors acknowledged that it is still unknown if the overall benefit is clinically meaningful or cost-effective. A 2010 review found real acupuncture and sham acupuncture produce similar improvements, which can only be accepted as evidence against the efficacy of acupuncture. The same review found limited evidence that real acupuncture and sham acupuncture appear to produce biological differences despite similar effects. A 2009 systematic review and meta-analysis found that acupuncture had a small analgesic effect, which appeared to lack any clinical importance and could not be discerned from bias. The same review found that it remains unclear whether acupuncture reduces pain independent of a psychological impact of the needling ritual. A 2017 systematic review and meta-analysis found that ear acupuncture may be effective at reducing pain within 48 hours of its use, but the mean difference between the acupuncture and control groups was small and that rigorous research is needed to establish definitive evidence. Lower back pain. A 2013 systematic review found that acupuncture may be effective for nonspecific lower back pain, but the authors noted there were limitations in the studies examined, such as heterogeneity in study characteristics and low methodological quality in many studies. A 2012 systematic review found some supporting evidence that acupuncture was more effective than no treatment for chronic nonspecific low back pain. The evidence was conflicting comparing the effectiveness over other treatment approaches. A 2011 systematic review of systematic reviews found that for chronic low back pain, individualized acupuncture is not better in reducing symptoms than formula acupuncture or sham acupuncture with a toothpick that does not penetrate the skin. A 2010 review found that sham acupuncture was as effective as real acupuncture for chronic low back pain. The specific therapeutic effects of acupuncture were small, whereas its clinically relevant benefits were mostly due to contextual and psychosocial circumstances. Brain imaging studies have shown that traditional acupuncture and sham acupuncture differ in their effect on limbic structures, while at the same time showed equivalent analgesic effects. A 2005 Cochrane review found insufficient evidence to recommend for or against either acupuncture or dry needling for acute low back pain. The same review found low-quality evidence for pain relief and improvement compared to no treatment or sham therapy for chronic low back pain only in the short term immediately after treatment. The same review also found that acupuncture is not more effective than conventional therapy and other alternative medicine treatments. A 2017 systematic review and meta-analysis concluded that, for neck pain, acupuncture was comparable in effectiveness to conventional treatment, while electro acupuncture was even more effective in reducing pain than was conventional acupuncture. The same review noted that it is difficult to draw conclusion because the included studies have a high risk of bias and imprecision. A 2017 systematic review for an American College of Physicians clinical practice guideline found low to moderate evidence that acupuncture was effective for chronic low back pain, and limited evidence that it was effective for acute low back pain. The same review found that the strength of the evidence for both conditions was low to moderate. Another 2017 clinical practice guideline, this one produced by the Danish Health Authority, recommended against acupuncture for both recent onset low back pain and lumbar radiculopathy. Headaches and migraines. Two separate 2016 Cochrane reviews found that acupuncture could be useful in the prophylaxis of tension-type headaches and episodic migraines. The 2016 Cochrane review evaluating acupuncture for episodic migraine prevention concluded that true acupuncture had a small effect beyond sham acupuncture and found moderate quality evidence to suggest that acupuncture is at least similarly effective to prophylactic medications for this purpose. A 2012 review found that acupuncture has demonstrated benefit for the treatment of headaches, but that safety needed to be more fully documented in order to make any strong recommendations in support of its use. Arthritis pain. A 2014 review concluded that current evidence supports the use of acupuncture as an alternative to traditional analgesics in osteoarthritis patients. As of 2014, a meta-analysis showed that acupuncture may help osteoarthritis pain, but it was noted that the effects were insignificant in comparison to sham needles. A 2013 systematic review and network meta-analysis found that the evidence suggests that acupuncture may be considered one of the more effective physical treatments for alleviating pain due to knee osteoarthritis in the short term compared to other relevant physical treatments, though much of the evidence in the topic is of poor quality and there is uncertainty about the efficacy of many of the treatments. A 2012 review found the potential beneficial action of acupuncture on osteoarthritis pain does not appear to be clinically relevant. A 2010 Cochrane review found that acupuncture shows statistically significant benefit over Sham Acupuncture in the treatment of peripheral joint osteoarthritis. However, these benefits were found to be so small that their clinical significance was doubtful, and probably due at least partially to placebo effects from incomplete blinding. A 2013 Cochrane review found low to moderate evidence that acupuncture improves pain and stiffness in treating people with fibromyalgia compared with no treatment and standard care. A 2012 review found there is insufficient evidence to recommend acupuncture for the treatment of fibromyalgia. A 2010 systematic review found a small pain relief effect that was not apparently discernible from bias. Acupuncture is not a recommendable treatment for the management of fibromyalgia on the basis of this review. A 2012 review found that the effectiveness of acupuncture to treat rheumatoid arthritis is sparse and inconclusive. A 2005 Cochrane review concluded that acupuncture used to treat rheumatoid arthritis has no effect on ESR, CRP, pain, patient's global assessment, number of swollen joints, number of tender joints, general health, disease activity, and reduction of analgesics. A 2010 overview of systematic reviews found insufficient evidence to recommend acupuncture in the treatment of most rheumatic conditions, with the exceptions of osteoarthritis, low back pain, and lateral elbow pain. Other joint pain. A 2014 systematic review found that although manual acupuncture was effective at relieving short-term pain when used to treat tennis elbow, its long-term effect in relieving pain was unremarkable. A 2007 review found that acupuncture was significantly better than Sham Acupuncture at treating chronic knee pain. The evidence was not conclusive due to the lack of large, high-quality trials. A 2005 Cochrane review concluded that there is not enough evidence to determine if acupuncture is effective as a method to treat shoulder pain, post-operative pain and nausea. A 2014 overview of systematic reviews found insufficient evidence to suggest that acupuncture is an effective treatment for postoperative nausea and vomiting, PONV, in a clinical setting. A 2013 systematic review concluded that acupuncture might be beneficial in prevention and treatment of PONV. A 2009 Cochrane review found that stimulation of the P6A cup ointment on the wrist was as effective, or ineffective, as antiemetic drugs and was associated with minimal side effects. The same review found no reliable evidence for differences in risks of postoperative nausea or vomiting after P6A cup ointment stimulation compared to antiemetic drugs. A 2014 overview of systematic reviews found insufficient evidence to suggest that acupuncture is effective for surgical or postoperative pain. For the use of acupuncture for postoperative pain, there was contradictory evidence. A 2014 systematic review found supportive but limited evidence for use of acupuncture for acute postoperative pain after back surgery. A 2014 systematic review found that while the evidence suggested acupuncture could be an effective treatment for postoperative gastroparesis, a firm conclusion could not be reached because the trials examined were of low quality. Pain and nausea associated with cancer and cancer treatment. A 2015 Cochrane review found that there is insufficient evidence to determine whether acupuncture is an effective treatment for cancer pain in adults. A 2014 systematic review published in the Chinese Journal of Integrative Medicine found that acupuncture may be effective as an adjunctive treatment to palliative care for cancer patients. A 2013 overview of reviews published in the Journal of Moulton.
Please subscribe and thanks for watching.